According to September 2009 statistics, the United States is the country with the largest number of lab-confirmed cases of the H1N1 flu. How much do we know about H1N1? What do we do to prevent or limit the spread of H1N1? We asked some Brooklyn College students about it.
H1N1 is kind of like a strain of a flu, and I believe that every year there's a new kind of strain of the flu, and that you should get vaccinated every year because it's different every year.
Cold, the headache, the body aching, the fever.
Is by not coming into contact. I know it's an airborne disease. I know that it could be transmitted by coughing, sneezing, touching.
About the H1N1 virus, I know that there's a preventative vaccine that they're experimenting with these days, and I know that if you have symptoms, you're supposed to go to the doctor and get yourself checked out right away.
As we move into the regular flu season, this year we find that we're confronted with a new strain of the disease called H1N1. Although the symptoms are very similar to seasonal flu, sudden onset of fever, high fever, chills, headaches, body aches, there are some other symptoms such as nausea and vomiting that have been reported in patients with H1N1. But the main difference between the two types of flu is that a younger population from ages 5 through 25 seem to be at higher risk of contracting H1N1. If you think that you may have contracted the flu, we urge you to treat yourself the way you would normally take care of any flu. That is, with lots of rest, plenty of fluids, and over-the-counter fever reducers such as aspirin, acetaminophen, or ibuprofen to reduce your fever. Take your temperature. Stay at home until you feel well enough to return to school or work. If you have school-aged children, the Department of Health is making available free of charge flu vaccinations at various sites throughout the city. Contact the New York City Department of Health for further information. If you're feeling sick, you can help to avoid communicating the disease to others by coughing or sneezing into your elbow like this. Finally, to prevent contracting either H1N1 or seasonal flu, take some simple precautions and make sure to wash your hands on a regular basis and avoid touching your face, particularly your mouth, your nose, and your eyes.
Now that you've had a chance to watch the video and to learn what our students think and what our health clinic professionals have to tell you about the H1N1 virus, both President Karen Gould and I are very concerned about your health and well-being. If you need information about H1N1, I urge you to please consult both the website of the City University of New York and the website of Brooklyn College for the most recent information. If indeed it is necessary for you to miss some time due to illness, we urge you to please take the opportunity to get better before one returns to the classroom. You will be given every opportunity to make up any work that is missed. The H1N1 is a serious yet very, very manageable threat to the health of our campus community. Once again, we are very, very concerned about your health and well-being, and common sense and best practices will help us to get through this period of time. Once again, on behalf of the President and myself, I want to thank you for watching this video, and I want to encourage you to use common sense in good practice in the future. Thank you.